So I think we're going to go ahead and get started. Um, my name is Philip Landrico. I'm the Assistant Project Director for SOAR 2.0. I am also the project lead for the Summit region. So it's great to see a bunch of familiar faces and names here in the meeting this afternoon. Welcome and thank you for joining us for the first regional collaborative call of 2022. I hope everyone is staying warm on this very cold day and as well. Um, I am joined here today with other members of the Grants Administration Bureau. Um, we are going to share the presentation duties, whether we're presenting, monitoring the chat, or running the slideshow. We also have a presenter today from the Summit region, and we are joined by the SARDI evaluation team from Wright State University. Just some general housekeeping items before we get started today. If you'd be ever so kind to mute yourself and turn off your camera, we'd appreciate that during the meeting. The meeting is being recorded and may be posted to our Ohio Moss website. If you have any questions, feel free to ask them in our chat box. We will be having someone monitoring the chat and answering questions very promptly or saving them for certain times to ask the questions aloud, whether in the middle of the presentation or at the end. So again, we have the chat box for that. Also in the chat box, we will be putting links as they pertain to the presentation for easy access. Feel free to click on the links, bookmark them and save them so you have access to those after the meeting is over. Just a quick update that the Ohio Moss website for federal grant projects does contain FAQs and additional information about these projects. Please use the following link and that will be provided for you in the chat. This link does go to our new website, and we'll talk about that website in a few more slides. This specific link does go to the apply for funding page, which lists all of our grants and projects that we do that community members do get funding from. So that'll include block grants, SOAR projects, discretionary funds, and the Table B spreadsheet. So that is a general application for that. And here we have a link for our quarterly collaborative survey. If you'd be ever so kind to complete the survey during or after the meeting, it should only take about 5 minutes of your time. And we really do appreciate that here at the Bureau and the department. This survey does give us a lot of vital information about how we do for the meetings. If the information today was helpful to you and gives you the opportunity to provide feedback on what information will be helpful to you in the future. This information allows us to craft up new material for the next quarterly collaborative call. In this case, will be sometime in April, and we will be sending out those invites sometime in the month of March. So be on the lookout for those. I know that sometimes they might end up in spam boxes and things of that nature. If you have any questions about the quarterly collaborative call or the survey, please let us know. Here we have a general overview of the grants administration team, the staff, the role that they have, and if they're a particular region or grant that they work under. Again, I am the lead for the Summit region, as well as my duties as the assistant project director, so I will be doing that today. With that, I would like to introduce Dr. Valerie Alloy, who is our chief of the Bureau of Grants Administration, for opening remarks, and a welcome. Dr. Alloy.
Well, thank you so much, Philip, and good afternoon, everyone. As people were jumping on the call, I saw many friends and colleagues. So hello, everyone. It's good to see you in this space. So I get the wonderful pleasure of just giving the opening remark. And I don't want to say we saved the best for last, but this concludes our regional calls, quarterly calls for this kickoff. And what we have been saying on behalf of the department is really just to take a moment to express our gratitude for all of our partners and all the work that you're doing to serve the citizens of Ohio. The department is fully cognizant that we were in an opioid epidemic prior to the pandemic. And the type of service that we have all been needing to give over the last 2 years has been extraordinary. And so we want to say with gratitude that we understand that, and that we also have grace in understanding the difficulty of doing service, providing service under the circumstances that we've been in the last couple of years, in already a very challenging piece of the work. We understand that staffing, access, and trying to stand up your projects according to the original timeframes has put, is a lot of work and has put a lot of strain on our systems. And so we do understand that. And so we extend grace to you all as our partners in that space. We also know that Ohio still stands as one of the top 10 states in opioid deaths, and therefore we have a lot of work still to do. And we want to thank you for rolling up your sleeves and continuing that hard work that we are partnering with you for. The conversation that we're about to have today, though, is critically important for all of us, and particularly we at the department, as we listen with a laser focus on the types of strategies and activities that have proven successful in this battle, and the types of activities and strategies that need to be sustained, and then those that we are finding perhaps not as useful in moving our needle. And then we're listening with a laser focus in our ears, and I want to say, and with our hearts, to really understand the conditions and the needs that you all have in reaching our clients and making change. So I'm excited about the conversation, the dialogue, the understanding, the collaboration, and we enter the space with a laser focused open mind and open heart in gratitude and grace for what we are about to do and need to continue to do. So with that, I won't belabor the opening remarks any further, but I just want to extend that to you on behalf of the department. And let's get to the agenda items. I'll turn it back over to you, Phil. Thank you.
Thank you very much, Dr. Alley, for that warm welcome. So we'll get started on 2.0. Thank you all for all your hard work on making SOAR 2.0 year one a successful first year. Here in the department, we do effectively call the first year of SOAR 2.0 2.1, and the second year of SOAR 2.0 2.2. So you may hear us use those shorthands to talk about the first year or the second year throughout the presentation, and any correspondences you may see in the future from the department. SOAR 2.1 did end on September 29th, 2021, and that meant that SOAR 2.2 did start on September 30th, 2021, and will run through September 29th, 2022. The closeout process for year one was successful, and we plan to continue to move this process forward. In the fall, at the end of the grant period, we will disseminate reminder notices and information regarding the closeout process for the current year at that time. And let's see here. Next slide, please. Just as a reminder, that the unspent award amount from year one was requested as carryover for year two. Any carryover amounts received are not returned to the original awardee, and that Ohio Mosque senior leadership does have the final decision on how carryover funds are awarded. Please keep in mind that mid-year reports are going to be due in March. The department will be sending out the narrative forms to complete sometime early next week. And please use this template when you are completing and submitting these updates no later than March 11th of this year. If you have any questions regarding the mid-year reports, please reach out to your project lead, which is me, and I will be happy to direct you with those questions. My favorite part about the reporting season is I get to read so many amazing stories and successes of what's going on in the field and get a really good feel of how things are happening here in Ohio. So thank you for your time in advance for completing these reports, and I look forward to seeing them. Just a quick update on SOAR 2.0 funding statements. If you are planning to use any print media or training materials of the like that are funded through SOAR 2.0 funding, that the following disclaimers should be placed somewhere in small print on the item. Please reach out to your project leads for copies of this statement, as well as official logos from Ohio Moss and from SAMHSA. For those of you that are tuning in via telephone, I will read the statements aloud for you. This publication or program was made possible by grant, and it lists the grant number. Just for reference, that the grant number does have a 02 at the end in significance of the year 2 of SOAR. And this is from SAMHSA. Its contents are the sole responsibility of the author and are not necessarily representative of the official views of SAMHSA. The other example we have here for training material is funding for this training was made possible in part by the Ohio State Opioid Response, SOAR. It again lists the grant number from SAMHSA. The views expressed in written conference materials or publications and by speakers and moderators do not necessarily reflect the official policies of the Department of Health and Human Services, nor does mention of the trade names, commercial practices, or organizations imply endorsement by the U.S. government. Again, if you do plan on using these, using print or media or training with SOAR funding, these will need to be included on those things. Feel free to reach out to me at any point, and I will help you get that information as soon as possible. You can also put your questions into the chat at this time as well. Next slide, please. Just some more updates on our website. As we mentioned in our last quarterly collaborative call, the department as a whole got a new website. This means that the SOAR project does have a new website as well, and the link is listed below. We will put that link into the chat. On our website, you will find some familiar items such as the Community Investment Guidebook. We are working to update the guidebook for year 2, so you'll be seeing an update on that shortly. You'll see information updates on the website, regularly updated FAQs from today's meeting and the rest of the meetings that we had this week with the quarterly collaborative calls. We do compile a list of the questions and answers that we do receive and put out and put that on our website for people to reference. Reporting requirements and links to the Wright State University SARDI program. So if you go to the link for the SARDI program, you will see things like the GPRA consent form, access to the iPortal to complete GPRAs, training dates, etc. And SARDI will talk about that more this afternoon. A calendar of events, again, we'll see the regional quarterly collaboration calls listed there in GPRA trainings. The next quarterly collaborative call, like I said before, is going to be scheduled for April with a reminder sent out this coming March. And then a list of allowable costs. Again, the link is in the chat room. If you have any questions about the website, please let us know. I do suggest that people take the time to familiarize themselves with the website, not just the SOAR projects, but the other projects. There's a lot of good, useful information and tips and hints out there that the department has put forward. Moving on to SOAR 1.0 NCE. SOAR 1.0 did end officially on September 29th, 2021. We really want to thank everyone for their amazing hard work that was completed under this grant. We were very impressed by the amount of work that went into it, the lives and Ohioans that were touched by each and every one of these projects. The Bureau did complete a 3-year end-of grant report and submitted it to SAMHSA in December. We are only expecting to send back a very small amount of money to the feds. And this is just an amazing feat, and I want each and every one of you to be aware of this and proud of this accomplishment. So we thank you for your time and energy spent on SOAR Prime, and we look forward to the continued work and effort that's put into SOAR 2.0. With that, I would like to introduce Christine Sealski, the Assistant Chief of the Bureau of Grants Administration, to give us an update on the grant end of Marquetta. Christine?
Thank you, Philip. I'd like to wish everybody good afternoon. I want to talk a little bit this afternoon about Marquetta. First, I want to thank the boards and all of their agencies for their participation in the Matt Padoa grant. This important work has made a big difference to the people in your local areas, and we really appreciate all of the dedication and hard work that went into this grant and to serving the people with OUD. So the Matt Padoa grant, like several of the other grants, did close on September 29, 21. That is the close of SAMHSA's year, and very little of the funding will be returned to the federal government. And I wanted to let everyone know that there is not a continuation or extension of the Matt Padoa grant. It is completed now and closed, and there is not another Matt Padoa grant forecasted. So I want to again thank you for your work on this grant, and if you have any questions, you can reach out to me. So now I want to turn our attention to the RSP grant. That was the Regular Services Project grant. It was a joint FEMA and SAMHSA grant that was had a goal of helping people in Ohio who had opioid use, had been affected by the pandemic and had pandemic stress. This grant spans September 28th of 2020 to October 24th of 2021. And as you can see on the slide, the grant was very successful. Originally, when we wrote our application for the grant, we said that we would serve about 47,000 individuals in Ohio, and we far exceeded that with the 651,159 individuals. One of the things that made this grant really successful was the outreach and referral that was done, which was the prescription for this particular grant. Those were the tenets that needed to be done. But then the paraprofessionals working on this grant went a step further and also did another outreach to make sure people who were given referrals for resources actually received the resources or were able to contact the resources. In some cases, we found that individuals didn't have computers or weren't able to make appointments. And so the staff that worked on this grant were able to help them to get what they needed from the resources. So kudos to the boards and to the providers and the paraprofessionals that worked on this grant. Also, I want to thank everybody for the impact stories. Those impact stories that came in mean so much. We do send them off with our report to SAMHSA, and we do share them on our various calls regarding the RSP grant. The impact stories are that emotional connection or bridge that creates a picture between the data that you see here on the slide and what was actually done for individuals in each locale. So thank you for those stories. I think every grant that we have, sending in impact stories is such an important facet of each grant. It gives us a picture of what's really going on the ground, and it does make the data come to life. So thank you for those. And I want to congratulate everybody who worked on this grant. It will be featured in a future SAMHSA publication. We're really proud of that. And when it is published, we will be happy to share that publication piece with you. So thank you.
Thank you, Christine, for your updates with the RSP grant and the Matt Padoa grants. Moving forward, we're going to get more specifically into the Summit region. And I am happy to introduce Dr. Marquetta Robertson from the UMADOP of Dayton to give a project update regarding their project there. And Dr. Robinson, please unmute yourself and feel free to turn on your video camera and take the floor.
Thank you very much. Good afternoon, everyone. I am honored to be here today to share a little bit about what we have been doing with the Source 2.0. So I want to start off with some of the things that we had did in the first year of the Source 2.0. And one of the things that we found to be really, really significant was the outreach component and being able to engage and create community awareness. So we collaborated with multiple churches being that churches are very strong in the grassroots of actually touching people, especially in the minority community. So through those churches, we engaged in community and promoted awareness through town hall meetings. We held 4 town hall meetings among 4 different churches that was also promoted through our agency's webpage as well as the church's social media platform. And then we also engaged in 2 community awareness events over the summer because we didn't actually get funded until late June. And so what we found was we were able to reach in the community 4,500 individuals, giving them that information, that awareness. We also engaged in media messaging and the public services announcements and getting the individuals awareness to where to go to get and access services. One of the other things that we did was we thought that it was really important to bring together the community as a whole. And so we offered trainings, one of them being bridge and prevention and recovery. We offered a healing circle. We also did, what was the other training? Training on health equity and health disparities. We got a good turnout of that because not only did we get the engagement of community members, we got engagement of faith-based leaders. We also got engagement from the recovery community as well as professionals and stakeholders. And so moving into SOARS 2.0, into the year 2 and the new SOARS that we are now engaging in, we continued on while we were waiting on funding because the inquiries and the demand to be able to receive that information was really important. So we continue to engage and collaborate with our churches. And so far going into this process, we have already done 2 town hall meetings on virtual platform as well as an in-person format. And then we engaged with the churches during their holiday season. And what we did was we found that really beneficial to be able to do an outreach and engagement awareness component. So while the churches were doing the Thanksgiving baskets and the Christmas baskets, we were actually there along with them, providing them infographics and information toolkits. We gave out over 1,000 toolkits. But we also delivered some of those into the low-income housing projects where substance use is highly prevalent in those areas, as well as among 3 senior living environments. And that was very helpful. But one of the things we also did and took a strong look at is we finding that in order for the individuals, and this is the information that we got from participants and clients engaging in services, is in order for them to be consistent, they needed to address some of the barriers. So through the funding, we were able to help individuals with transportation to get to their appointments. Although we're doing our treatment component on a hybrid level, so there's a virtual component for the group sessions, but then the urinalysis and the individual sessions are done in person. And so them being able just to get back and forth to those appointments, as well as in our agency, we have an area where there's a library with some computers. And so if they had issues with childcare, we had staff available to put the children into the library where they can work on computers, do some prevention working on substance abuse awareness, or work on some homework while the parent was actually into their sessions doing their treatment services. Again, we continue with the media messaging. And one of the things that was really, really beneficial and we found to be really fun, we did a healing circle and we started the healing circle based off of a town hall community conversation. And that was focused on social injustice in communities of colors and the lack of access to treatment and other services. From that, we were able to compile data on the response from the participants and saw that there was a readiness to change within the community, and specifically the community of color in the Montgomery County area. And so we have now continued that on by doing monthly lunch and learn strategy sessions. And so that includes community members, faith-based members, the recovery community, as well as professionals. And we come together during that lunch period so that it doesn't interfere with anybody's work to help us identify, strategize, and address the substance use and mental health and the other issues that are affecting the community so that we can help heal it. And that has been very beneficial as well. One of the things that I want to say is on this new segment here, we do need to get that information to add to our upcoming trainings and our documentation, our infographics, and other information that we're also doing on our door knocker hangers and our mailbox distribution. Does anybody have any questions on some of the strategies that we have been using?
Thank you very much, Dr. Robinson, for going over that. I absolutely think it's integral to include minorities' focuses and what they need specifically for to keep themselves in treatment and for recovery supports. I'd like to know more about your engagement with the churches and how you collaborate with them and what kind of services that you guys are looking to do in the future beyond what you're already doing with the churches.
Well, actually, that's a great question. Our collaboration with the churches is we come in and we either co-host or we host within that church facility. That way we can be able to reach not only their congregation, but the people within their community or within their surrounding area. We're also able to tap into their social media platform to be able to reach the individuals that are not being able to get out and engage in person due to the COVID. Two of the churches that we are connected with are what you would classify as mega churches. And so they also have sister churches and other churches up under them. So the expansion of the outreach is a little bit broader. The other thing that we do in collaboration with the churches is when they have events, they allow us to come in and do surveys, social needs surveys. We do environmental scans as well as distribute information and dissemination on different things, such as in our toolkit, we have information such as about medication-assisted treatment. We have information on the facts of opioid use disorder, addiction as a chronic disease, the cycle of addiction, and then we also have the Get Help app now, the Get Help Now app at the local and the state level, so that people can be able to actually know where they can go and call those places and get that information. We also do a thing on challenging the myths about MAT, and we pass that information out at those individual events, as well as doing them in those housing incomes, in those high risk areas where there's a lot of substance abuse, a lot of substance trafficking, where that availability is so high. Some of the things that we got coming up down the pipe, and I'm really, really excited about this, is one of the churches that we are actually partnered with under our Source 2.0 grant is now getting ready to set up to be a COVID testing site. And at that particular site, they're allowing us to come in and partner with them. And so while they're doing the COVID testing, we can not only do the information and dissemination, but we can actually find out what resources and linkages can be able to happen through that process of helping the individual get connected to services, whether it be treatment, education and awareness, MAT, mental health, or whatever.
Thank you so much, Dr. Robinson, for that elaboration. It sounds like there's a lot of good things happening down here in the Summit region. I just want to say that you've received some accolades in the chat box, just saying that how wonderful and awesome you and your program are. So that should be a compliment to you. I would like to invite anyone else that has any questions for Dr. Robinson or comments about their project at the Umadapa Dayton, to go ahead and unmute yourselves and ask those questions now, or put your questions into the chat. And as a reminder too, we'll also have time to ask more questions at the end of today's presentation as well.
I don't necessarily have a question, but Dr. Marquetta, this is Karen Vi from East End Community Services. And I just wanted to let you know if there's ever anything that we can do to work with you or collaborate or coordinate. You know, we still always recognize you as first of all, training expert. Thank you so much. You do a lot for our community. And then also just helping to keep us all aware of the need to, you know, to definitely look beyond and keep expanding our outreach and support. So let us know. We love our SOAR dollars and love what, you know, we can do, and love to work with you if we can. So thank you.
Yes, absolutely. Absolutely. Thank you.
Thank you very much for that, Karen. And thank you, Dr. Robinson. Moving on. Now I would like to introduce the SARTA evaluation team at Wright State University to give their update regarding data collection for SOAR 2.0.
Thank you, Philip. Hello, everyone. My name is Brady Wilson. I'm joined by Jenna Killian and other colleagues in the SARTA department. And today we want to talk about a few updates for our evaluation, reporting numbers, and our upcoming training schedule. Just a minor heads up before we begin, our internet seems to be a little spotty. So if I cut out, just let me know in the chat box and I'll try and reiterate whatever I missed. So if we can go to the next slide, we'll begin. So starting with an evaluation update for the numbers, at the very top, you will see the number of intake GEPRA that have been completed to date. That number is 13,083. Below that, we have the number of intake GEPRA for the SOAR grant year 2. Currently, we're sitting at 3,327 intake GEPRA, which is 37% of our goal. So absolutely fantastic job on that. Even though we are only a quarter of the way into the year, we are already over a third of the way to our percent of the 9,000 GEPRA intake goal. Breaking that down to the right is by project type. We have local board in the lead with 2,829, which makes up 85% of all intake GEPRA, followed by a community organization at 6.1%, innovation at 6.4%, MOM program at 2%, and ODJFS, Ohio Workforce, at 15 GEPRA at less than 0.5%. Moving on to the next slide, we will talk about discharge and follow-up interviews. So for 6-month follow-up, we have 3,366 follow-up record, which is both completed and administrative. Of the follow-up records, 2/3, 2,207 were full interviews, with the rest being administrative. And the completed follow-up rate for those of GEPRA currently in window is 27%. Leading into discharge, that gives us 1,539 discharge records, which are both completed and administrative. Next slide, please. And finally, we did make a few changes to the biweekly report to further show these numbers. So the way to read this now is the first column is the intakes for the entire year 1, followed by a column for year 2. The first part of that is the number of intakes that were completed within the last 2 weeks, followed by the number of total interviews completed for the year so far, followed by the number of service-only records that have been entered for intakes. And the last part of this second column is a summation of those previous 3 parts. This is followed up by follow-ups. So again, the number of follow-ups that were completed within the last 2 weeks for the organization, as well as the follow-up rate. This is taken by divided the number of follow-ups that have been done project to date by the number of follow-up GEPRA that have entered eligibility window. And finally, for the last column is the number of discharges that have been completed project to date. If you have any questions on this or any other part of the numbers, please do not hesitate to reach out at a group email. That'll be posted at the end of the slide, as well as Ohio Moss's website. With that being said, I will hand this over to Jenna to talk about training.
Thank you, Brady. As he said, my name is Jenna Killian, and I work here at Wright State with the SARTA team, and I'm going to go over our training updates. So on the screen in front of you right now are the training numbers for the past 3 months, October through December 2021. We trained a total of 120 people, with 102 of those being trained on our full SOAR 2.0 GEPRA training, 15 of those being trained in our update and refresher training, and 3 of those attending our group Q&A sessions. So the group Q&A sessions may seem like it has kind of a low number, but actually a lot of our trainings have turned to individualized trainings. We do Zoom meetings and phone calls and emails on a daily basis with providers. So even though this group Q&A number has gone down, we've been doing a lot of our Q&A on the individualized level. And then the only other thing I wanted to hit on this slide is just a huge reminder that all new hires or people new to the GEPRA collection process for SOAR are required to go through our provided training. That is a requirement that SAMHSA has set up for us. We have had a lot of emails in the past couple of weeks, and even one today, of people trying to get access to the SOAR portal without attending the mandatory training or being trained by someone else in their agency. This is not allowed. In the previous grant, I know it was the train your trainer format, but there were a lot of inconsistencies that we had pop up with this format, so we changed it to be a mandatory training for SOAR 2.0. And so just a reminder that anybody new to SOAR needs to go through this full training before they can start completing GEPRAs. Next slide, please. So on the screen in front of you now is our schedule for the next few months of trainings. As usual, we have our full SOAR 2.0 GEPRA training. We have our update and refresher training and our group Q&A sessions. To sign up for these and to access this schedule, you will visit our website, which we will place in the chat box. Next slide, please. Along with our usual trainings that we offer, we are also offering a new mandatory training. Those will begin in February and run through March. These are to go over mostly the follow-up and discharge interviews. We've had a lot of questions lately surrounding these two interviews, and we know that we throw a lot of information at you in our full training, and so you're normally focused on the intake, and so sometimes when those follow-up and discharge interviews come up, you have a lot of questions surrounding those, so we're going to really hit those home and answer some of the common questions we've had on those lately. Also, hopefully this will help with our follow-up and discharge rates and help brainstorm some ideas to help contact and get those interviews completed. We also have had some questions on the locator form and consent form and at where to find and how to properly fill out those documents. So we're going to be going over those as well. These trainings are going to be on Tuesdays and Thursdays in March, and they will be about 1 hour long. Again, in front of you are the proposed training dates. Once those are finalized, we have a few things we need to finalize with those, but once they are done, they will be on our SOAR website with our other trainings. Next slide, please. As I already mentioned, we have been doing a lot of technical assistance with the follow-up and discharge interviews, helping people come up with strategies and ways to get these accomplished properly. We also have been helping people with deleting interviews if there are duplicate interviews or something of that nature. And this is also a very difficult task to delete interviews, so we have been helping providers come up with strategies to ensure this does not happen again in the future. As I mentioned, we've been going over how to properly fill out and find the consent and the locator forms. We've also been helping people gain access to the SOAR 2.0 iPortal after they have completed the training. And then as Brady mentioned, we added the discharge interview data to our reports to help with keeping track of those interviews. Next slide, please. So again, here is our email and our website if you have any questions for us and when you want to access those trainings and the schedule for our trainings. Please feel free to email us at any time. We are more than happy to help with any questions that you may have, especially if you ever aren't sure about something. We are more than happy to help eliminate any confusion that you may have. So with that, I'm going to head and turn it back over to Philip, and I just wanted to say thank you for all the great work that you all are doing.
Thank you, Jenna and Brady, for that update. We very much appreciate it. Your feedback is important to us. So again, if you could please complete the quarterly collaborative call survey at the end of our meeting today, we'd greatly appreciate it. This survey does help us craft future meetings for not just this area, but all of Ohio. So thank you for your time in advance. It shouldn't take you more than 5 minutes. And we put that again, that information back into the chat box if you missed it the first time. Lastly, we are on social media, so feel free to follow us and learn about things that are happening in the state and with the Department of Mental Health and Addiction Services. Again, feel free to peruse our new site and familiarize yourself with the content that is available there. At this time, I would invite anyone who has any questions regarding today's presentation from myself or any of the other presenters to unmute themselves and ask the questions or put those questions into the chat box. Well, while we're looking and waiting for anyone to type up their questions, I just hope that Southern Ohio is warmer than it is in Northern Ohio. So I appreciate the ability to eventually see the Summit County region when we get back out into the field and meet everyone in person. I've had the great privilege of meeting some of you via video call or phone call since I started here, so I'm looking forward to that.
Hi, Philip.
Hi, Zoe.
We have a couple of questions in the chat box right now.
Okay.
The first is, do we have any word on the SOAR 2.0 new funding today?
I will let Chris or Dr. Alloy answer that question.
We need clarification if this would be new funding, as in the next phase of SOAR. There is a forecast that there may be future funding, but it has not been posted yet. So we'll just need to keep watching to see when and if it is posted. But thank you for your question.
Okay. If there are no more questions, I will look at the chat box really quickly. There are more questions. There is a specific question for will there be a SOAR 3.0 funds, and will there be an application process for 2.0 carryover? Again, I will let Chris or Dr. Alloy answer this question.
So as far as carryover is concerned, Ohio MOS has applied for carryover. However, until we would receive a NOAA or more information about our application, we can't, make any kind of an application process available at this point. We have to wait to be awarded the actual funding. And for SOR 3.0, there is, as I said, a forecast that the federal government will be posting another iteration of SOR. However, the details are not yet in full and it hasn't been posted. So until it's posted, we won't have all of the details and we won't be able to apply for it. Once it is posted, of course, we would apply for it at that point. Thank you for your question.
Thank you. If there are no more questions, the meeting is adjourned. I hope everyone stays well and it stays warm. And I look forward to seeing everyone in our next quarterly collaborative call in April. Thank you.